Afternoon, doctors. Today we are having one of the best and senior consultant neurosurgeon with us, Dr. Abhida Shah. Doctor will guide us on the fiber organization of brainstem, on novel classification and surgical implications. So, doctor, now it's hand over to you. We will start the session.
So, is my voice clear?
Yes, doctor.
Okay. You can see my screen? You can see my screen?
Yes, doctor.
Okay. So, good afternoon, everybody. And let's talk about the brainstem today. I want to keep it interactive. So if any one of you want to stop me at any time and ask a question, you can do it right there so that you don't have to wait till the end of the lecture. Because we know that the anatomy of the brainstem is quite complex and it takes a lot of time to understand it. But if you do master the anatomy, if you understand the simple structures, how it has been structured, you will be able to easily understand the neurological symptoms and signs that occur because it is pure mathematics. If there is a lesion in the brainstem and is causing a certain symptom, it has to be located in that area. It cannot go anywhere else. But to understand that, first you have to understand the anatomy of the brainstem. So this is a recent publication that we have done from our department. The dissections in this presentation have been done. A few of them have been done by me, but majority have been done by Dr. Sukhdeep and Dr. Nunez. So you will see how beautifully it has been dissected. So the brainstem is a compact structure and is made up of both gray matter and white matter. The white matter is of more abundance than the gray matter. And that is why it is a very compact structure with a lot of fiber bundles that run through and through the brainstem. It is basically a conduit that connects the cerebrum to the spinal cord and to the cerebellum. So the gray matter part of the brainstem is basically made up of cranial nerve nuclei, and at each level we have different cranial nerve nuclei, and there are native gray matter masses of the brainstem. So native brainstem nuclei. And the white matter, this is not the traditional way that it has been classified, but I have recently classified this in the publication, and I will show you why this is relevant and why it makes it very easy to understand. So when you are drawing your cut sections of the brainstem, if you understand this organization, it becomes very easy for you to understand. So I've divided it into short and long projection fibers, traversing fibers, association fibers, and the decussations or the commissural fibers. So we'll go into that later. First, let's see the gross anatomy of the brainstem, then the internal structure of the brainstem. So basically the brainstem has two arms, the cerebral peduncles, and they are like this Greek god Atlas, which holds the celestial heavens. He's holding the whole burden of the earth on his hands. So this is our cerebral peduncles, and similarly it holds the whole cerebrum on its hands along with the head, which is the thalamus. So you see this, these cerebral peduncles resemble the hands of the Greek god Atlas. That was the ventral view of the brainstem. So this is the midbrain, the pons, and the medulla. The dorsal aspect of the brainstem is covered mainly, the pons and the medulla mainly covered by the cerebellum. And superiorly, this part is exposed, and that is the midbrain. So this is the midbrain. Once we open the cerebellum and open the fourth ventricle, you'll be able to see the dorsal aspect of the pons and the medulla. So now if you see this image, you see this is the pineal body. This is the thalamus. So basically the thalamus sits like a head on top of the brainstem. So in primitive animals, this is the basic structure that is required. We have developed the cerebellum, the telencephalon, and the power of memory and the power of emotion and the power of reacting to stimuli in a more advanced manner than primitive animals. So this is the basic function, basic structure of the brain that is required for survival. If you see this white structure here, I'm just showing for the interest, that this is the massa intermedia or the interthalamic adhesion. And this is the third ventricle, the cavity of the third ventricle. Now going further, so what happens in the brainstem? Now this is the ventral view of the brainstem. And the most important thing to remember is on the ventral aspect of the brainstem, completely through the midbrain, through the pons and through the medulla in the midline is the corticospinal tract. And this forms a big block to approaching the brainstem from the ventral aspect. So we will see later how safe avenues and safe zones and safe areas are designated so you can enter the brainstem. Now the brainstem grossly is divided into three parts: the midbrain, the pons, and the medulla. So the midbrain extends from this line just below the optic chiasm and the optic tract up to the pontomesencephalic suture. The pons extends from the pontomesencephalic flexure suture to the pontomedullary junction, which you can see here. And then the medulla becomes the spinal cord later just beneath the pyramidal decussation, as I will show you when we are doing the medulla. So the midbrain, this is the gross structure of the midbrain. These are the mammillary bodies. So basically, when you see a lateral view, the midbrain extends from the mammillary body to the posterior commissure. That is the superior boundary of the midbrain. I will show you in the lateral view. This region here between the two cerebral peduncles is the interpeduncular fossa. So as you know that there is an anterior perforated substance in the cerebrum, between the two cerebral peduncles is the posterior perforated substance. And what does it traverse? All the basilar perforators. So just like you have middle cerebral artery and anterior cerebral artery perforators that go through the anterior perforated substance, that is the lenticular striate arteries. Similarly, through the posterior perforated substance, the perforators of the basilar artery enter. There is a gray matter mass in this region, the interpendicular ganglion. I will show you in a later image. This structure that comes out on the ventral aspect of the brainstem from this oculomotor sulcus is the oculomotor nerve. This is the optic tract. Going further, that was the ventral aspect of the brainstem. This is the dorsal aspect of the brainstem. So you see these four rounded elements. This is the superior colliculi and the inferior colliculi. They are separated by this cruciate sulcus. And the superior colliculi are partly covered by the pulvinar of the thalamus. So you have to separate the pulvinar so that you can see the superior colliculi very clearly. And there is a depression on the superior aspect of the superior colliculi where the pineal body rests. So this is the pineal body. This is the depression in the superior colliculi. And as I showed you earlier, this is the third ventricle and this is the interthalamic adhesion. Laterally, if you see, as I told you, what is the superior limit of the midbrain? So you see this mammillary body and the optic tract. So you draw a line from here posteriorly right up to the third ventricle, posterior commissure. So that is the superior limit of the brain, of the midbrain. And here beneath is the pontomesencephalic structure. So the lateral aspect of the midbrain has the lateral mesencephalic sulcus, which divides this into a anterior part and a lateral part of the cerebral peduncle. So this lateral part of the peduncle has the lemniscal triangle and carries in it the lateral lemniscus, which is part of the auditory pathway. So when you see the cut section of the midbrain, you can divide it into two parts. So the peduncle and the tegmentum. Now this part of the tegmentum is the tectum, which consists of the colliculi and the aqueduct. So a plane passing through the aqueduct divides it into the tectum dorsally and the tegmentum in this region. The ventral part is the crus cerebri, and the tegmentum consists of this pigmented layer that you see here, the substantia nigra, and this structure here that you see here is the red nucleus. And of course, there are many other fiber bundles that come, and we will see. Basically, you should remember that the medial lemniscus, as it runs from the midbrain to the medulla, it divides the brainstem into the ventral part of the brainstem and the dorsal tegmentum. So the medial lemniscus is especially in the midbrain and the pons. It's a very clear demarcation that forms, dividing into the ventral brainstem and the dorsal brainstem. So going further, now you've seen grossly the anatomical features of the midbrain. Now let's dissect it layer by layer. So as I told you earlier, this is the posterior perforated substance. So from the medial aspect of the cerebral peduncle, in this, there is a region called the oculomotor sulcus. And from here, the oculomotor nerve arises. Mind you, all the cranial nerves are related to the ventral aspect of the brainstem, except the trochlear nerve, which comes out dorsal. So first thing to remember is the cerebral peduncle here. So a cerebral peduncle can be divided into three parts: the medial 1/5, the middle 3/5 and the lateral 1/5. The middle 1/5 has the cortico-nuclear fibers and the frontopontine fibers. These are the fibers that arise from the frontal lobe and go to the pontine nuclei. The cortico-nuclear fibers traverse from the cortex all the way and stop at various levels in the brainstem, ending in the brainstem nuclei. The middle part of it is made up predominantly of the corticospinal tract. And laterally here, you can see this eye, that is the temporopontine fasciculus or Turk's fasciculus. And these are fibers that come from the temporal and the occipital lobe and join and end in the pontine nuclei. So this A is the frontopontine fibers. This I is the temporopontine fibers, and H that you see here is the bulk of the corticospinal tract. And as you see it, it will go into longitudinally down into the pons. Now this region here harbors the interpeduncular ganglion. So as you see in this image, this is the corticospinal tract as it traverses from the midbrain down into the pons. Now further fiber dissection, again, first we'll finish the cerebral peduncle here. So these are the frontopontine fibers, the corticospinal tract, and the temporopontine fibers. This is the optic tract as it is going into the lateral geniculate body. This is the region of the third ventricle. This is the fornix. This is the mammillary body. This is the corticospinal tract as it enters into the pons. Here is the olfactory nerve, and this is the optic nerve. So you see these nerves on the ventral aspect of the brainstem. Now going further, I've cut here the frontopontine fibers. So what do you see here? The pigmented lamina that you see here is the substantia nigra. The substantia nigra is thick in this region and it curves all the way laterally and becomes thinner as it goes laterally. So it is thickest in this region, and this is the substantia nigra. Beneath it, in the depth, is the red nucleus. I will show it in the next image. So this structure here, this J thing, is the native brainstem nuclei. So the brainstem is a gray matter mass of inherent to the brainstem itself, and that is the interpeduncular ganglion. And this is the corticospinal tract. Going further, now you see this whole structure here. So I've removed the substantia nigra, and this is the red nucleus. And you can see how the oculomotor nerve traverses on the middle aspect of the red nucleus. This is the corticospinal tract as it is going into the pons. This frontopontine tract has been cut here and reflected. So then you can only see the red nucleus and the substantia nigra. Beyond it will be the medial lemniscus. So if you see, this is the lateral image, lateral view of the brainstem, of the midbrain and the pons. So here is the lateral lemniscus. This is the superior cerebellar peduncle. Here posteriorly is the medial lemniscus. These are of course fibers of the pons, as I will show you later. This is the medial lemniscus going down into the medulla, and this is the middle longitudinal fasciculus. This is the superior cerebellar peduncle as it forms the roof of the floor of the fourth ventricle. So we looked at it from ventrally and from laterally. Now when we look at it from dorsally, so when you remove the cerebellum, this part of the brainstem gets uncovered. So now you can see the fibers in this region. So first of all, this is the pineal body as it rests in this depression between the superior colliculi. So this C structure is the superior colliculi. This is the inferior colliculus. Now there's a thin white layer that comes from this and extends down to the brainstem. This is the frenulum villi. And just lateral to it, you see this thin band that is emerging, and that is the trochlear nerve. Now, what is this? These fibers that are going up. So this is the superior brachium. These are fibers from the superior colliculus as they go on to join the lateral geniculate body as part of the visual pathway. And this structure here, these fibers up going to the medial geniculate body is the inferior brachium as it goes on and forms the part of the auditory pathway. Now this structure here on both sides are the superior cerebellar peduncles as they connect to the cerebellum to the dentate nucleus. So the superior cerebellar peduncle is the efferent pathway of the cerebellum. It starts from the dentate nucleus and then goes on to the midbrain and then decussates ventral to the aqueduct to form the superior cerebellar decussation and goes on to the opposite side. On both the sides, the superior cerebellar peduncle is collected by this thin layer that is the superior medullary velum. So this region here forms the floor roof of the fourth ventricle. If you see these fibers here, this is the middle cerebellar peduncle. And this structure that you see going up laterally is the lateral lemniscus, as it arises from fibers in the cochlear nuclei, the acoustic striae, and goes up and joins the medial geniculate body. Now going on to the pons. Now this complex structure of fibers that we see here, I'm going to delineate them one by one to you. So looking at the ventral aspect of the pons, so you see it is extending from the pontomesencephalic sulcus to the pontomedullary sulcus. This is the basilar groove in which, or the basilar sulcus in which the basilar artery runs. This is the fibers as they run to form the middle cerebellar peduncle. So it is called the middle cerebellar peduncle at the junction of this trigeminal nerve. So when the trigeminal nerve, where it enters, in front of that is the corticopontine fibers and just transverse pontine fibers, and just beyond the trigeminal nerve, we like to call it the middle cerebellar peduncle. Now the nerves that come out in this region are ventrally is the abducent nerve here, 6th cranial nerve, and laterally the 7th and the 8th cranial nerves, as I will show you in the image. Now, once you remove the thin gray matter in front of the pons, there is a various plethora of fibers that you see here. So there are fibers that are running transversely and there are fibers that are running longitudinally. So first layer that will be is this thing A. These are the transverse pontine fibers. The transverse pontine fibers are arranged in 3 layers. So the first layer is the stratum superficiale, and that connects basically the transverse pontine fibers to each other and actually goes on to form the middle cerebellar peduncles. So this stratum superficiale lies in front of the corticospinal tracts. So this B that you see here are the corticospinal tracts. So see, you see this one layer, that is the superficial layer in front of the corticospinal tracts. Then you see this C, that is the second transverse layer, that is called a stratum complexum, because it splits the fibers of the corticospinal tract. So there are longitudinal fibers of the corticospinal tracts intermingled with the transverse fibers of the corticopontine fibers. And once going further, after the corticospinal tract, so after these longitudinal fibers, there is another layer, that is the stratum profundus, and that is the last layer of the transverse pontine fibers. So what are these transverse pontine fibers? So if you remember, I had told you the corticopontine fibers, as they traverse, they end into the pontine nuclei and they give out fibers that run transversely into the cerebellum, forming the middle cerebellar peduncle. So all these 3 layers of the transverse fibers come together and form the middle cerebellar peduncle. So this is the complex ventral part of the pons. Going further, once you remove that deep layer of transverse fibers, these longitudinal fibers that you see, so this, now you're reaching the 4th ventricle. So this cavity here is the floor of the 4th ventricle. In the midline here is the medial longitudinal fasciculus. Just lateral to is the central tegmental tract. And this structure here is the medial lemniscus. This region that you see F is the locus ceruleus, and we will see it from the dorsal aspect when we see the floor of the 4th ventricle. Now you see this B is the corticospinal tracts, which have been cut here, and A is the superficial layer of the transverse pontine fibers. So now the longitudinal layer has also been removed, and you straight enter into the 4th ventricle, and you see this prominence here that I will show you from the floor of the 4th ventricle. Now looking at it laterally, so as I told you, where the trigeminal nerve enters, beyond that is the middle cerebellar peduncle. Up to that, you call it the part of the pons. Achha, the name pons means bridge. Basically, it is a bridge that connects fibers of the cerebrum to the cerebellum. So it is a bridge between the cerebellum and the cerebrum. So that is a main conduit connecting the cerebrum to the cerebellum. Now this region that you see here, B, is the flocculonodular lobe of the cerebellum. And I will show you more clearly later. This, as we saw earlier, is the abducent nerve. The trigeminal has a medial small motor root, and laterally is the large sensory root. When you look at it from ventrally, this is the flocculus. So the flocculus actually covers the junction of the cerebello-mesencephalic fissure, cerebello-pontine fissure, sorry, and the cerebellomedullary fissure. So see, this fissure here is the cerebello-pontine fissure, and this is the cerebellomedullary fissure as they continue up, and they just have this junction here, which is just posterior to the flocculus. So these are the facial and the vestibulocochlear nerves. These are the glossopharyngeal, vagus, and the cranial part of the spinal accessory nerve. Now looking at the lateral aspect of the brainstem, of the pons basically. So now I showed you this earlier. This structure A is actually the superior cerebellar peduncle as it emerges from the dentate nucleus and runs upwards to the midbrain, forming the roof of the fourth ventricle. D is the cavity of the fourth ventricle. This is the flocculus. This structure that is in the midline, in the floor of the fourth ventricle, is the medial longitudinal fasciculus. And these are, of course, fibers of the pons. Now you see here, this is the superficial layer of the transverse pontine fibers. Intermingled between the complex layer is this corticospinal tracts. And then again, there is a deep layer of the pontine fibers. So you see these longitudinal fibers of the corticospinal tract as they run into the medulla here, forming the medullary pyramid. Just posterior to this structure here is the medial lemniscus. So in the medulla, it lies just beneath just posterior to the pyramid, and just dorsal to the pyramid. And when it goes to the pons, it moves slightly laterally and has a concave shape here. So you can see that this concave shape of the medial lemniscus as it is facing ventrally. So this is the medial lemniscus. These are fibers of the sixth cranial nerve as they are traversing to emerge in this region. This is the medial longitudinal fasciculus along with the central tegmental tract in this region. Going further, you can see this more clearly. You can see the fibers of the corticospinal tract as they go on to form the pyramid. You can see fibers of the medial lemniscus as they are moving down into just dorsal to the pyramid in the medulla. This is the fibers of the superior cerebellar peduncle as they are forming the roof of the fourth ventricle. This is the medial longitudinal fasciculus along with the central tegmental tract. Now you see this, the fibers have been removed through and through. So you can see the trigeminal nerve as it emerges from the motor and the sensory nuclei of the trigeminal nerve in the pons and goes all the way coming out in the region of the middle cerebellar peduncle. These are the fibers of the sixth cranial nerve. So that was the pons, and the dorsal part of the pons, that is the fourth ventricle, we will cover as one whole part as the floor of the fourth ventricle. Now coming to the medulla. So this is the region of the medulla extending from the pontomedullary junction to this area just above the emergence of the C1 spinal nerve, just above that and just below the decussation of the medullary pyramids. Till that is where the medulla extends. So the prominent structure that you see in the midline is the pyramid, which is broader on top and narrow as it goes down. This here is the foramen cecum here. Just another depression here from which the sixth cranial nerve will emerge. Lateral to the pyramid is the olive. So in this, so basically there is a midline furrow here and ventral midline fissure, which is a continuation of the anterior midline fissure of the spinal cord. This is the anterolateral sulcus between the pyramid and the olive, from where the rootlets of the hypoglossal nerve emerge. This is the posterior lateral sulcus, from which the rootlets of the glossopharyngeal, vagus, and the accessory nerve emerge, which lies posterior to the pyramid, posterior to the olive. So the medulla can be divided into three parts: the anterior part, the lateral part, and the dorsal part. So as you see from here laterally, so this is the anterior district of the medulla, this is the lateral district of the medulla, and more posteriorly on the floor of the fourth ventricle is the posterior district of the medulla. So you can see it more clearly now, the rootlets of the hypoglossal nerve emerging, and these are the rootlets of the glossopharyngeal and the vagus nerve. Here you can see the vestibulocochlear nerve, and this is the abducent nerve. Now, when you dissect further and remove the first layer, you see transverse running fibers that run from the midline, go over the pyramid, go over the olive, and go into the region of the inferior cerebellar peduncle. And these are the external arcuate fibers. So there are two, there is an external arcuate fibers and an internal arcuate fibers. So the internal arcuate fibers are actually the decussation of the medial lemniscus or the sensory decussation. These are the external arcuate fibers. So again, you can see the fibers. So this is the corticospinal tract as it is running down from the pons into the medulla. These are now this is the olive, and these are some fibers of the external arcuate fasciculus. Now this structure here is the inferior cerebellar peduncle as it is coursing up. Now the inferior cerebellar peduncle is mainly made up of the dorsospinal cerebellar tract as it runs from the spinal cord into the inferior cerebellar peduncle. And just then next to it is the ventral spinocerebellar tract, which goes all the way up to the superior cerebellar peduncle. Now looking at it from the ventral aspect, so this is the corticospinal tract as it is running. This, when you remove the corticospinal tract, the structure that you see here is the middle lemniscus. Now you can see all the way from the pons how the corticospinal tract is running into the medulla. And this is the region of the pyramidal decussation or the medullary decussation, as I will show you more clearly. So here again, this is just a closure view showing the pyramidal fibers, the middle lemniscus that is behind the pyramidal fibers. And this is the region of the pyramidal decussation. So majority of the fibers, as you can see in this image, cross over to the opposite side in the pyramidal decussation. However, there are a few fibers laterally that continue down straight without decussating and from the anterior corticospinal tract. These fibers which decussate form the lateral corticospinal tract. Now we've seen the internal organization, fiber organization of most of the brainstem. Now looking at the floor of the fourth ventricle, and anatomy of the floor of the fourth ventricle is very important for all of you. And it is also important for all of us as surgeons because we encounter it very frequently when we are operating on fourth ventricular tumors, especially. So now you can see that the cerebellum has been cut here. This is the middle cerebellar peduncle. This is the roof, and that is the superior cerebellar peduncle. And here is the inferior cerebellar peduncle. Now this is the ependyma of the fourth ventricle. This is the choroid plexus. In this region is the flocculonodular lobe. And what are these white lines that you see it? You see it very consistently when you're operating. You will identify these white lines, and these are the striae medullaris. And they are actually acoustic fibers as they run from the cochlear nuclei and go towards the midline. Now, once you remove the ependyma of the fourth ventricle, these are the fibers that you will see. So first, this is the ependyma. Now the floor of the fourth ventricle can be divided into three parts. So a superior part here that is triangular, an inferior part here that is again triangular, and an intermediate part here, which is a horizontal part that is present in the floor of the fourth ventricle. So how do you divide it? So this is the midline sulcus in the brainstem. Next to it is the sulcus limitans laterally. So here this region is the medial eminence. So when the superior part of the floor of the fourth ventricle, so this, when you draw imaginary line just above the facial colliculus in this region and let it run from one side to the other side. So at the lower border of the superior fovea, and this is the apex, and the lateral border is the superior cerebellar peduncle. So this is the superior triangle of the floor of the fourth ventricle. Now this region, that line runs from the superior fovea and runs in imaginary line connecting the tinea on both the sides. That is the intermediate part, and that has mainly the facial colliculus. And the lower part runs from this tinea imaginary line and going all the way to the calamus cryptarius in this lower part of the floor of the fourth ventricle. Now, when you remove the ependyma, so let's look at the structures one by one. So let's come from laterally. This is the superior cerebellar peduncle, the roof that has been removed, this O that is cut here. This is the roof of the fourth ventricle. This is the superior medullary velum. This is the middle cerebellar peduncle. And coming from here laterally and turning is the inferior cerebellar peduncle. So these are the three peduncles that you see. Now, right in the center here is the facial colliculus. And the facial colliculus is actually made up of the abducent nuclei and fibers of the facial nerve. So this is the facial nucleus, and fibers emerge from the facial nerve. They run inferior to the abducent nucleus, come all the way to the midline, turn upwards, and then come out again and go in the lateral aspect to emerge from the pontomedullary sulcus on the ventral aspect of the brainstem. So this is the prominence that you see on the floor of the fourth ventricle, and that is the facial colliculus. Now, just above this is the region of the superior fovea, and just below it is the region of the inferior fovea. So here you have a triangular region here that is bounded by the middle sulcus, by the sulcus limitans, and it actually has fibers of the central tegmental tract. Just beneath this is the medial lemniscus. And if you see this pigmented layer here, this is the locus ceruleus. And just again beneath that, if you trace this, you will see the central tegmental tract. Now, this is the hypoglossal trigone. This is the vagal trigone. This has the hypoglossal nucleus and the intercalatal nucleus in this region. And this is the region of the vagal trigone, which has the nucleus of the vagus nerve. This that you see here is the fasciculus gracilis and the fasciculus cuneatus as they go about to end in the gracile and cuneate nuclei. So this is a closer view. This you can see is the region of the inferior cerebellar peduncle. So the dorsospinocerebellar tracts are continuing here in the region of the inferior cerebellar peduncle. This is the facial colliculus. This is the medial longitudinal fasciculus. These are the striae medullaris. As you can see that they're running from the cochlear nuclei and going all the way to the midline here and turning inwards. This is the medial lemniscus. Beneath this, in this region, you will also have the trigeminal nucleus and the spinal tract of the trigeminal nerve. This is the central tegmental tract. This is the hypoglossal nucleus. This is the vagal nucleus. So now we have seen majority of the anatomy of the brainstem. Now I will introduce you to this new classification that I have devised. So I have divided the fibers of the brainstem into 3 zones and divided them into these 3 kind of fibers. So zone 1 has the short projection fibers. Zone 2 has traversing fibers and long association fibers or long projection fibers. And zone 3 has association fibers and the various decussations. So if you see this, imagine the brainstem as a whole circle. So the first layer is zone 1. Of course, it does not come all the way in the midline. So the zone 1 is comprised of all the peduncles, the superior, middle, and the inferior cerebellar peduncle, and the lateral lemniscus. I will show you one by one as we go ahead. So basically, I want you to understand that it's like a cylinder. So why I have called them short projection fibers, I will go into that also soon. So first understand that there are 3 zones. So the first zone is incomplete anteriorly. Then in the middle, there is a zone 2. And right in the center, again like a cylinder, is zone 3. So if you see this image, this green circle is the zone 3. This blue circle are the zone 1. And this yellow one is zone 2. So again, if you see this diagrammatic representation, this green circle in the midline is zone 3. This yellow one is zone 2. And just outside on the outer aspect of the brainstem is zone 1. And when you see from ventrally, this is zone 1 and this is zone 2. Now, what is zone 1? Zone 1 are short projection fibers. So what are they? They are basically fibers that are connecting the brainstem to adjacent geniculate bodies and cerebellum. So they are very short fibers actually. They are connecting the brainstem to adjacent structures to the brainstem. And these are the bundles that form zone 1, the superior, middle, and the inferior cerebellar peduncle, the superior and inferior brachium, and the lateral lemniscus. So if you look at this image, this is the brainstem and these fibers. So this is from the dorsal aspect when you look at it. So the superior and inferior brachium, which is connecting the brainstem to the medial and lateral geniculate body. The superior cerebellar peduncle, which is connecting the brainstem to the cerebellum. The middle cerebellar peduncle, again connecting the brainstem to the cerebellum. And the inferior cerebellar peduncle in this region, this one. The inferior cerebellar peduncle, the middle cerebellar peduncle, and the superior cerebellar peduncle. And further laterally is the lateral lemniscus. So if you see, all of them are just on the outer boundary of the brainstem. And the important part to remember is zone 1 is a very safe entry to make an entry into the brainstem. If you understand which trajectory you're entering and you want to enter from zone 1 from laterally, it is a very safe entry zone for entering into the brainstem. So when you look from it ventrally, this is the middle cerebellar peduncle and this is zone 1. Now what is zone 2? Zone 2 is traversing and long projection fibers. Why do I call them? Traversing fibers are the ones that do not synapse in the brainstem. They just run through the brainstem. So this is the corticospinal tract, the lateral lemniscus, the dorsal and ventral spinocerebellar tracts. There is nowhere where they will synapse in the brainstem. But these long projection fibers, so medial and trigeminal lemnisci, the corticobulbar, corticopontine fibers, the reticulo-rubro and vestibulospinal fibers, they are are also long fibers that run from the brainstem to the spinal cord or from the brainstem to the cerebrum. And they all have a relay in the brainstem. That's why I'm calling them long projection fibers. So if you look at this lateral image, so this yellow circle is the zone 1, that is the superior cerebellar peduncle. These blue centers that you see here are zone 2. So corticospinal tract, the medial lemniscus, and all these fibers will be zone 2. And this purple circle here is zone 3, which I will go into now. So again, when you look at it ventrally, this is the corticospinal tract and zone 2, which we never enter the brainstem from here. We will always enter it laterally or sometimes, just sometimes in the midline in some safe zones. And again, if you look at the floor of the fourth ventricle, this is the region of the spinal and the trigeminal and the medial lemnisci, and that is how they run. And this is zone 2. So this is the inferior cerebellar peduncle. This is the dorsal and the ventral spinocerebellar tracts as they run into the inferior cerebellar peduncle. And this is again zone 2. So zone 2 is important because there are some designated areas through which you can enter. Otherwise, you cannot even damage anything in zone 2. And zone 3 is a complete no entry. You cannot enter in this area. It consists of the MLF, the tectobulbar tract, and the central tegmental tract. So this is this area. We are never going to enter the brainstem in this area from any side. So this is an absolute no entry. This is the middle longitudinal fasciculus, the central tegmental tract, and the tectospinal tract. So the relevance of this classification is that it is safe to enter the brainstem through zone 1. From zone 2, you can only enter through designated safe areas. And basically remember that zone 3 is a complete no entry. So let's look at these safe entry zones or how you can enter. Now from the ventral aspect of the midbrain, though we don't normally enter, people have described this area and the medial 1/5 of the cerebellar peduncle that traverses to the frontopontine tracts and just lateral to the oculomotor nucleus to enter into the ventral aspect of the midbrain. So in this, when you enter from here, you're in the depth, you have to be careful. Once you reach the substantia nigra and the red nucleus, you cannot go up that. It's a very rare trajectory that is being used by some people, but I will show you another trajectory that we have found, which is much more safer. So this is the lateral part of the tegmentum in which the tumor is in this region. And here, this can be safely approached through the lateral mesencephalic sulcus or through the lemniscal triangle, which goes through the lateral lemniscus or zone 1. So you can see this bulge that you can enter laterally, and this is safe to enter. As I showed you, it comes in zone 1. So it is very easy to enter the brainstem from here. So here, this is that area where you can enter. So the lateral part of the cerebral peduncle, this is the lemniscal triangle. This is the lateral mesencephalic sulcus. This is the dorsal midbrain. Now, when I was studying the brainstem, I came across this new avenue. Just like you can enter from the frontopontine tracts, you can also enter from the temporopontine tracts, which is part of the lateral 1/5 of the cerebral peduncle. So this is the region. So if you see this tumor here, coming from here will damage a lot of structures. But if you can come from here, you'll be able to easily access this lesion because the corticospinal tracts, as you see here, are pushed medially. So this is a recent paper that we have published, the lateral cerebral peduncle approach to ventrally placed intraaxial midbrain tumors. So if you see the midbrain, the designated safe areas are from the ventral aspect, from the lateral. This lateral mesencephalic sulcus is a designated safe area to enter the midbrain. And then there are some supra and infracollicular areas that you enter. If you see the cut section, this is the region of the red nucleus. This is the middle longitudinal fasciculus. This is the substantia nigra. This is the medial lemniscus. So what we have devised is this approach through this part of the cerebral peduncle. So as I told you, it is divided into the medial 1/5, the middle 3/5, and the lateral 1/5. So once you enter from here, the substantia nigra comes in this region. So if the tumor is located in this region, if you enter between the cortical fibers, corticopontine and the corticospinal tracts, posterior to those tracts, through the temporopontine fibers, in front of the substantia nigra, you will be able to enter and approach this tumor. So this is the trajectory. And I will show you an example. And this can be approached either from a supracerebellar avenue or from a subtemporal avenue. So this is in the sitting position, the supracerebellar root. The cerebellum has been depressed. And if you see the cerebellum has been depressed, you have to cut the tent to reach this region. You identify the trochlear nerve by cutting the tent and displacing it inferiorly. And this is the entry point, and this is the trajectory to approach the lesion. So this is a tumor in the ventral aspect of the midbrain, which again, you cannot come from here. You cannot come from here. There are too many problems. There's the basilar artery. There are the basilar perforators. The trajectory of the working length is too long. So if you enter from this lateral aspect and you go into this tumor, you will be able to easily resect it, as you can see in this. And the patient did not have any deficits. This turned out to be an oculomotor schwannoma, and the patient developed a third nerve palsy. So this is an operative video. This has been operated by Professor Goel, and you can see the supracerebellar avenue here. I'll just show you quickly how you can go in. So this you can see is the trochlear nerve. This is the tent. You have to go above this in the region of the lateral cerebellar peduncle. So this is going ventral to the brainstem. You can see that you cannot approach the tumor from here. The tumor was not even visible in this area. So now the tent is being cut. This is the trochlear nerve. We'll go further. So now you can see that the fourth nerve is down. The tent has been opened. And now you will see how you can enter the brainstem using this approach. So here, this is the fourth cranial nerve, and a small entry is now being made in the lateral part of the cerebral peduncle, or the lateral cerebral peduncle approach. And you can see that the fibers are being displaced rather than opened, and straight you can enter into the tumor. So this is a very good trajectory to approach ventrally placed midline tumors in the midbrain. So this is, I think I missed. So you can see that the solid portion of the tumor was very eminently removed using this approach. So this is again another tumor, again in the lateral part of the brainstem. Again, using this approach, you can see the resection, complete resection in this patient. Patient did very well. So as I said, you can either go from above the cerebellum, or you can go from subtemporal. So lifting the temporal lobe and again entering in the lateral part. So when you see an operative view, you can see this is the fourth cranial nerve. This is the lateral aspect of the brainstem, and you can enter in this region. So this is a tumor which was approached through the subtemporal route, as you can see, and you can see the incision in the brainstem in the lateral part of the cerebral peduncle, and you can see the tumor excision. Now, what happens in the dorsal part of the brainstem? Normally, tectal plate gliomas are small. We do not need to operate them, but this is a larger tumor in this region. How will you approach this? It's technically challenging, but there are certain safe areas from which you can enter. So this is the supracerebellar route. Again, we have operated in the sitting position, and the designated areas are either above the colliculus, above the superior colliculus, or just beneath the inferior colliculus next to the frenulum velli. So this is the region where you can enter into the brainstem. But of course, you have to be very careful because there are a lot of critical structures that come in this region. But these are some areas from which you can enter if you have to approach a tumor in this region. Looking at the pons, do not enter the pons from this region. You cannot enter. You will damage the corticospinal tracts. So how do you approach the pons? You come laterally. So again, this is just a cut section of this part is the pons. This is actually the aqueduct or the upper part of the pons. And this is a tumor. Of course, there is no doubt about this, that you will approach this laterally from the CP angle, retrosigmoid. And otherwise, even though if the tumor is here, you cannot come from ventrally. You have to approach this through the middle cerebellar peduncle. And you can see here that the corticospinal tract is displaced medially. Here you can see it very clearly. So when you come from it laterally, there will be no chance of damage. Where is the entry point when you enter from laterally? It should be just beneath the trigeminal nerve in this region. Do not, and anterior in this region. Do not go too posterior. Do not go near the facial nerve because you will damage the intrapontine fibers of the facial nerve if you come in this region. So this is the area that you see here is safe to enter into the middle cerebellar peduncle. So this is the operative view. Once you retract the cerebellum, you see this bulge here, and this region you can enter and you will straight reach the tumor. So this is the tumor that was approached by this angle, and you can approach this tumor. Now, there are some tumors which project into the floor of the fourth ventricle. Generally, as far as possible, try to avoid the floor of the fourth ventricle because it has too many critical structures which can cause damage. But if at all you have to you should also remember that when there is a tumor, it has caused so much distortion of the brainstem that it is difficult to identify this safe entry zones also. So you have to try to decipher the anatomy and find a location. This white structure you will always see, stria medullaris. So at least you know that you're above the stria medullaris. So this is the designated safe entry zone has been described. This is the suprafacial and this is the infrafacial. This is in front, above the facial colliculus, above the superior fibers of the facial nerve, and the infrafacial zone is beneath the fibers of the facial nerve, as you can see here. And when you open the brainstem, see, this is how the brainstem looks. It is distorted by the tumor. It is very difficult to identify the anatomy. So you go roughly by the landmarks that you can identify and try to find the area. So again, this is a tumor that is completely in the fourth ventricle, which there is no other way. You will have to go through the fourth ventricle. But again, you enter where the tumor projects most superficially and try to make an entry in that area, and you will be safe when you come from there. These are just a couple of interesting cases. If you see this tumor, you would be tempted to come from dorsally. But if you see, look here, there is a connection with the clivus. This is actually an endodermal cyst of the brainstem, an intraaxial endodermal cyst. Of course, we came to it from the dorsal aspect, but if we had known preoperatively, maybe we would have changed the approach. And this is another patient again with a coming in the dorsal aspect of the brainstem, approach to the floor of the fourth ventricle. This was again another endodermal cyst, and this has been published by us recently. Coming to the medulla, it is difficult to enter the medulla, but if you have to enter only from the sulci that are present, the midline sulcus or the posterior lateral sulcus that are present. That is the safest way to enter, or in the region of the inferior cerebellar peduncle. So if this is the tumor, you do a DTI, you see where the tracts are displaced, and you can enter from this region, in the region of the inferior cerebellar peduncle, which is zone 1 again, and remove the tumor. Avoid the floor of the fourth ventricle. This is the approach, a midline suboccipital craniectomy. You lift the cerebellum and you'll be able to see this in the region of the inferior cerebellar peduncle, and then approach the tumor. Do not enter into this because there are too many, the vagal nuclei, the glossopharyngeal nuclei, the hypoglossal nerve, all which will, if you damage, will cause a severe problem. The lateral aspect of the brainstem of the medulla can be approached again from a retrosigmoid avenue, and you can again approach a pre-olivary or a post-olivary approach. If you are entering from a pre-olivary region, try to enter beneath the rootlets of the hypoglossal nerve, and post-olivary, try to be between the glossopharyngeal, below the glossopharyngeal and the vagal rootlets. So these are some designated safe areas to enter the medulla. And this is the anatomy of the brainstem, and I'll be happy to answer any questions. Thank you.
Hello.
Yes, sir.
Yeah, I'm really thankful to deliver the wonderful session.
Hello.
Are there any questions?
Yes, ma'am. We will have a question answer session for the. Anyone having the questions? We will take the question answer session for 10 minutes.
I think everyone has understood the brainstem, or not understood anything. Abhinav? I think he has left.
So, doctor, if there will be no questions, so can we end the session?
If someone has asked a question, are there anterior
Yes,
safe entry zones? There are anterior safe entry zones from the medial, just lateral to the oculomotor sulcus for the midbrain. For the pons, there is no anterior safe entry zone. For the medulla, not as strictly anterior, but through the anterolateral sulcus you can enter. But most of the approaches are either lateral or to the dorsal aspect of the brainstem. But yes, if you want to come from an orbitozygomatic approach and approach ventral midbrain tumors, you can come from the midline. That is the only place I think you can come from the midline.
So, doctor, I think there is no question. So, can we end the session?
Yes, yes.
So thank you very much, Dr. Abhida Shah, ma'am, and also Dr. the audience, all the doctors, those who are busy in the wards and still you have taken out the time and joined the session. So thanks to each and everyone, doctor, and we will end the session.
Okay, Sachin.
Thank you.
Thank you.